All right, obstetrics. Let's talk about the vagina. So we have assessments of the pregnant patient and the pathophysiology of complicated scenarios. We have abnormal delivery, such as the nuchal cord and prolapse cord. You have breech delivery. You have all kinds of delivery up in here. Also, let it be noted, I'm talking on green. I don't know if this is of higher quality or not. Let's see if noise cancellation matters. Third trimester bleeding, placenta previa. So this is whenever there's bleeding, but the patient is not going to be in pain. I believe it's the placenta. The placenta is what's breathing. Now, abrupto placenta means that the placenta is ripping away from the vaginal wall, which is very painful, and it's going to present more blood, and it could actually, whenever there's complications giving birth, this could kill the mother, actually. What does that mean? Camera, no camera. I don't know what that means. Let's go back. What else? Spontaneous abortion. You could have a miscarriage. Very sad. Ectopic pregnancies, preeclampsia and eclampsia, antepartum, hemorrhaging, pregnancy-induced hypertension. So ectopic pregnancy, ectopic means something that is not where it's supposed to be. So like if you have an ectopic wave and a heartbeat, that's the same thing as an ectopic pregnancy. Let's say the baby fertilizes in the fallopian tube rather than the uterus, then that is a painful condition that could also be very life-threatening. Preeclampsia, eclampsia will go into antepartum hemorrhaging and pregnancy-induced hypertension. Hypo or hyper? Pregnancy-induced. We'll go into details on that. Trauma integrates the assessment and findings with principles of epidemiology, pathophysiology, to formulate a field impression to implement a comprehensive treatment disposition plan for the acutely injured patient. Special considerations, pregnant patient trauma, pediatric patients, and geriatric patient. If you have a pregnant patient, you don't have one patient, you have two patients. I don't know what that's to do with geriatrics. Pathophysiology and assessment and management of trauma in pregnant patient, pediatric, yep. Let's go through all this. Here we go. Okay, introduction is not a disease needing treatment. Women have been having children without emergency and other medical services since time began. They are very tough and can't handle it. However, if we can ease the process, we will do that medically, pharmacologically, and any way that we can. Emotions can be out of control, ranging from extreme excitement to panic. Keep a sense of professional calm and control. The number of patients increases from 1 to a minimum of 2. The pregnant woman and the fetus. Potential complications include maternal fetal death. Maternal infant mortality rates have been significantly reduced with modern medicine. Many problems are discovered before childbirth through close medical monitoring. Anatomy and physiology review. So you have two ovaries, you have two uterine fallopian tubes, you have the uterus, you have the cervix, you have the vagina, you have the mammary glands, and you have external genitalia. The ovaries are the beginning point for reproduction. The paired glands found next to on either side of the uterus. Size and shape of the unshelled almonds, that is the size. Similar to testes in the male. Your ovaries are your testes in female form. I know there's a lot of confusion about that in 2023, but let it be known. About 200,000 follicles are in each. Each follicle is containing an egg or oocyte. Oocyte? I've read this word so many times, I still don't know how to say it. Let's solve that right now. How do we say this word? But it's going to mess up my thing. We'll just leave it. Each month, about 20 of the follicles begin the maturation process. Only a single follicle matures and releases an ovum. The other follicles die and are reabsorbed. The cycle continues with the release of hormones throughout various stages. The anterior pituitary gland releases follicle-stimulating hormone, creating an oocyte to mature. The anterior pituitary gland releases luteinizing hormone as the menstrual cycles pre-ovulatory phase progresses, stimulating the ovulation process, release of the ovum. The luteinizing hormone is excreted throughout the cycle, stimulating the ovarian cells to produce the hormones estrogen, progesterone, inhibin. The corpus luteum is what is left on the follicle after the egg is released, and then at the end of the pregnancy, the prostaglandins and oxytocin signal the uterine contraction and labor. The ovum travels through the ovaries into the uterus through the fallopian tubes, and you have a ciliary motion that sweeps the egg into the fallopian tube. So like sperm has, what is it? It's the opposite of cilia. So cilia are like a bunch of little caterpillar legs on the cells that scoot it along. And then sperm, this is like 9th grade biology, I can't remember, but it has like the whip on the back, the tail, that slings it forward. Smooth muscle contracts and inner mucosa moves the ovum through the tube to the uterus. I'm still trying to remember what this word is. The egg encounters the sperm cell, may become fertilized. Fertilization process occurs at any time within a 24-hour period after ovulation. If it is fertilized, the ovum dies and degenerates within 48 hours. The endometrium breaks down and sheds the menstrual flow on the 28th day on the cycle. The endometrium is the wall. If an egg is fertilized, then the glands of the endometrium increase in size and secrete material on which the fertilized egg can implant and grow. The egg can then develop into an embryo and a fetus. Fetus, embryo. If the egg encounters a sperm cell, it may become fertilized. Fertilization can occur at any time within a 24-hour period after ovulation. If it is not fertilized, the ovum dies and degenerates within 48 hours. The endometrium breaks down and sheds the menstrual flow on about 28th day of the cycle. If the egg is fertilized and the glands of the endometrium increase in size and secrete materials on which the fertilized egg can implant and grow, the egg can then develop into an embryo and then a fetus. The uterus is a pear-shaped organ that lies between the urinary bladder and the rectum. The uterus is where the fertilized ovum implants, the fetus develops, and labor takes place. There are 3 layers of the uterine tissue. So you have the perimetrium, the outer protective layer, the myometrium, which is in between perimetrium and the endometrium, and then you have the endometrium, which is the inner lining. The cervix is the narrowest part of the uterus, and it opens into the vagina. The vagina is highly muscular, tubular organ, and it's lined with mucous membranes. That's what makes it slippery. The functions include receptacle for the penis during sexual intercourse, passage for exit of menstrual flow, and the passage for childbirth. The vagina is the lower portion of the birth canal. It stretches to accommodate fetus delivery. If it doesn't stretch enough, tissues in and around the perineum can tear. Significant pain and bleeding may occur. In the hospital, the physician may form an episiotomy, which is an incision in the perineal skin. In the pre-hospital setting, treatment is limited to providing gentle pressure against the newborn's head and to give tissues time to expand. There was a medic who actually performed the incision of the perineal skin and episiotomy during transport to the hospital. He's known as a legend. However, he did get fired for it because it was outside of his scope of practice. We can't do that. But he did it. Everything turned out fine, but, lawsuit. Mammary glands are modified sweat glands mainly composed